we're delighted to be sharing the first report and findings from the Welfare Experiences project, which is a partnership project with co-production partner organisations and academics across 5 countries, including Estonia, Spain, Norway, and the UK and Hungary. And for the first year of this project, we've been working with co-production partner organisations to conduct workshops with people claiming its benefits in their different countries. And the report that we're published today is the first report from the research, which is an in-depth exploration of people's experiences of claiming benefits across the 5 countries. And today we're going to have presentations from the co-production partner organisations in the UK. So that will be from Tracey Herrington at APLE Collective, and then from Pauline and Hussein from Inclusion Scotland. And we'll also hear from Trude Sundberg from the University of Kent and Ben Baumberg Geiger from King's College London as well about the next steps for the project. So just to mention as well, there is the option to add captions on the bottom of your screen, the CC button. If you click on that, you'll be able to get captions to go along with the speakers. We're also recording the webinar today, so we'll be able to share that link with you afterwards as well. So I'm going to pass over to Trude, who is going to start off by giving a presentation about the report that we've launched today. Over to you, Trude.
Hi, everyone, and thank you for coming to this event. I'm really excited that we're going to share not only the kind of overall findings of the comparative report, but that we also have our colleagues from Inclusion Scotland and the APLE Collective who will be able to share the more detailed of the lived experiences in England and Scotland. So what I will be sharing with you is about the findings across the 5 countries that we are studying, and I will keep it brief, and you will be able to find the full report on our website, and you can read it in detail, and we would very much welcome any comments that you might have. As Laura said, my name is Trude Sundberg, and I work at the University of Kent, and you feel free to contact me about any further questions you have about this report. The Welfare Experience project consists of 4 work packages, and this first report is based on work package 1, which is a co-produced conceptual framework of welfare experiences. The report that we are presenting to you today, and which is published in full on our website, is based on discussion groups in the 5 countries, and I'll tell you a bit more about that. But alongside that, we have done an academic literature review, and we are in the process of finalizing a new theoretical model for analyzing and understanding welfare experience. Now, we started with work package 1 on this project because it is focused around co-production, and co-production is a core value of this project. The next steps of the project will be a qualitative longitudinal study, a quantitative study followed on from that, and during the whole project, we will have different kinds of impact events. I won't go into more detail, but there is much more to come from this project, from each one of these work packages. So in work package 1, we are doing a comparative qualitative co-production study. And what we are presenting on today are results from 28 discussion groups across 5 countries and 6 nations. And the countries included are Estonia, Hungary, Spain, Norway, and the UK. And within the UK, we are looking both at England and Scotland. The discussion groups were led by co-production partners, partner organizations in each of the countries, and you will hear more from 2 of them today. And they were all conducted between June and November 2024. And as I've said, this is happening in parallel with an academic literature review, and we are in the process of finalizing a new theoretical model to understand welfare experiences. And this is all happening in collaboration between our co-production partners and the academic teams in each of the countries to create a truly co-produced theoretical model for how we understand welfare experiences, or the experiences of receiving benefits in each of the countries. And of course, not of course, but what we are aiming to do is to see if we can find policies and systems that enhance the security and dignity and fairness of the different systems, and finding the understandings of how we can create supportive systems. And I will say a little bit now in the next few slides in terms of what are the existing reported experiences across the 5 countries. Just a note on how we are looking at welfare experiences. We are trying to untangle welfare experiences, or the kind of experience concept, into experiences with the welfare systems that occur as you are dealing with the system, and the emotional impact and the feelings that you experience as a result of the experiences. And the reason for that is so that we can understand which experiences create which types of feelings and emotional impact, and in which people, if there are patterns by background, for example. And this is important so that we can really get a thorough understanding of what kind of systems and experiences create what emotional impacts and other kinds of impacts. And Ben will say a bit more about how we will study this more in depth in the next part of the project. So without further ado, an overview or kind of a summary of what you will find in the report show us that across the 5 countries, institutions frequently fail to fulfill their fundamental duty of supporting and providing dignity to the lives of those most in need. The experiences that we found in the 5 countries were largely negative, and systems were found to be complex, inaccessible, and the treatment received often inconsistent. Now, it's important to also say that in terms of inaccessibility, it's not just the language and the information given that might be inaccessible, it's also the buildings and the places themselves. So there are different dimensions to accessibility that we need to look at. The welfare systems are often found to be burdensome, unpredictable, and slow, and demand technical knowledge that are often beyond the reach of those facing a crisis. And added to that, and I think this is important, that there is also often a knowledge gap amongst caseworkers. There are comments in Norway, for example, that it really depended on which caseworker you got, because some know more than others. So there's a bit of a lottery, and I come back to that in a couple of slides. And as I said, the information that is provided often is found to be hard to access and confusing, and many quote that they need to rely on third-party support or family and friends to be able to understand the language and the information given, as well as how to navigate the system. And a high administrative burden was often reported, with paperwork being found very burdensome, and that you needed to continuously justify your need and your deservingness again and again when you are in the process of claiming and receiving benefits. The assessments were often found to be invasive, as were verification of details and bank details and how much you had in your bank account, etc. There's also often shifting rules, so rules would be shifting, and there was limited support. And sometimes payment errors and errors were being made, but it was often felt that it was those who were claiming or receiving benefits that had the responsibility there, rather than the organization that was making the payment errors themselves. It's really crucial to take into account a waiting time, as the waiting time often impacted people's stress levels, anxiety, and feelings of uncertainty. And the waiting time happened along many different dimensions, so waiting for decisions, clarification, and information. The assessments related to rehabilitation and disability were experienced as particularly invasive, and here we really saw that caseworker often lacked in knowledge. There are some positive developments in Spain, where they have introduced an in-home dependency assessment that was often found to be respectful and a humane approach. So there is something to be learned there. In terms of digitalization, there is a mixed story. Some had positive experiences as they had digital skills and access to appropriate devices, whilst others found this to be an added dimension of exclusion due to lacking technological access or literacy. There's also an aspect around the lottery in terms of inconsistent treatment and support across locations where you are in the country, and also a bit of a game of luck in terms of which caseworker you get to assigned. In terms of the emotional impact of all of these experiences, we found that interactions with systems systematically erode dignity, security, and justice. They led to feelings of anxiety, worry, and fear. Many reported experiences and feelings of shame, degradation, and dehumanization. And loneliness was a really common feelings reported, which was underlined and kind of strengthened by the fact that people would isolate themselves because they didn't want to be seen as being out and about, because then they were worried that they would be deemed less deserving of receiving benefits because they were too healthy to be receiving benefits. Feelings such as frustration, powerlessness, and lack of control were very common across the different countries, as was the feeling of not mattering. Now, it wasn't all negative. Many expressed gratitude when they did receive benefits, but this was very rarely the only or predominant feeling. So yeah, whilst there were positive feelings, it was not the only feeling. So they were always in a mixed bag of feelings. And many depicted welfare experiences as sources of trauma rather than support. And others reported that navigating the benefit system worsened existing physical and or mental health conditions. So I'm going to leave it there, but if you want to look at our full report, you can find it on our website, and I'll hand it back to Laura. Thank you very much.
Thanks, Trude. So we're going to move on now to firstly hear from Pauline, Nolan and Hussein Patwa from Inclusion Scotland. So I'll pass over to you.
Thank you so much. And I'm just looking to see if I can share my slides. I don't know if I can. Oh yeah, I can. So I'll share my slides, introduce you to myself, and then I'll be in conversation with Hussein Patwa, who is one of the participants in our engagement that we did on this. So my name's Dr. Pauline Nolan. I'm Head of Participation and Policy at Inclusion Scotland. Inclusion Scotland is a disabled people's organisation. It's a national DPO in Scotland, and we work to achieve positive changes to policy and practice so that disabled people are fully included throughout all Scottish society on an equal basis as others. And we do this by influencing decision makers, by supporting disabled people to become decision makers, and by building the capacity, awareness and engagement of decision makers and between disabled people, our organisations and the organisations and institutions that impact on disabled people's lives. So just to go through the slides. We held 2 focus groups in October and November 2024. One was in Glasgow at the Glasgow Centre for Inclusive Living, and one was online. And they were mixed groups with a lot of varied representation for such a small number, that totaled 13 people. So the focus and the main finding was the individual journeys through the UK government's benefit system for disabled people in Scotland, and we had the focus on their experience of universal credit, but people fed back on other benefits, including the adult disability payment in Scotland as well. And discussions revealed a range of negative emotions similar to those described by Trude. Thank you, Trude. They included anger, frustration, depression, and feelings of disappointment and futility. So overall, it really painted a stark picture of a broken system. So to inspire discussions, we used a series of positive, negative, and neutral headlines about benefits. There's some examples there on the page. One is benefits policy punishes people for working more. Another from Leicester said disabled women's benefits were restored out of the blue. Another was guidance, how to check entitlement as £2 billion of benefits have been missed. The Prime Minister's dementia advisor quits over benefits clawback policy, and disabled woman loses all benefits after DWP phone assessment. But there were many, many more, and people received these in advance. And we gave options to use creative and collaborative art. So the options were that people could use, there's an image there of magazines, and we brought a selection of magazines, and people could cut out and stick things to paper while discussing these headlines and feelings and experiences. And some people were offered to write poetry, but these creative methods were not accessible to all. And so really the people in the workshops led the workshops and decided how they would engage. And we used the headlines to guide discussions while facilitators made notes. We looked at the different processes from the application stage through the assessment stage and through to claim management, and each one caused pervasive anxiety, including mental and physical strain. A quote from our report, one participant recounted how attending an in-person assessment left them so exhausted that they were bedridden for 3 months. And then there was the fear of losing benefits and the stigma. So the real fear of as Trude mentioned, fear from past experiences as well. Through applications, there was a lack of options. They had difficult and complicated language. Excessive detail was required. The forms were inaccessible, and there was a lack of support to fill in forms. And people said that they were only easy to use if you had a professional background. Led people to feel that the system was designed to catch you out. So punitive assessments and claim management system, that's one of the words that people use to describe it. The focus seemed to be on pushing disabled people into work without additional support. The process was rigid, the structure was rigid, so people working irregular hours faced barriers and confusing calculations. There was relentless scrutiny, impossible standards, and in some, universal credit has failed to support disabled people wishing to work and disregards those who cannot. The focus should be on social security and not just benefits. So what we found in this really chimes in what we heard when we were consulting on the pathways to work and universal credit reform, and prior to our response to the universal credit bill. People were feeling very disappointed and let down by the government and called the changes proposed barbaric and inhumane. They wanted a fair and honest approach to welfare reform and not one driven by cost cutting. Disabled people we consulted knew that fraud is extremely rare and that portrayal of claimants as scroungers is harmful, unfair and inaccurate. They want the government to invest in removing barriers to independence, not to punish people for being disabled. And so this is the real headline for us, is that nothing about us without us. Don't design a service without disabled people that disabled people are going to have to use. We've been saying that all along, but we've never been properly involved in reforming social security at the Department for Work and Pensions level. And once again, the United Nations Committee for Disabled People has criticised in the strongest terms the UK government, asking it to carry out a comprehensive assessment of the human rights impacts of its universal credit cuts bill. We urge the government to listen to disabled people and our organisations, to drop these plans and to focus on creating a fairer, more accessible society. That's the end of my formal presentation, and I'll stop sharing now. I think, if I can find the button. And bring in questions for Hussein. Hussein Patra, I'll introduce you, was a participant in the research. Welcome, Hussein. Would you like to introduce yourself for a moment before I start asking you some questions?
Thank you very much, Pauline, and good afternoon, everyone. Thank you for joining. It's good to see such a healthy attendance here. I'm Hussein Patwa. I'm based up in Aberdeen in the northeast of Scotland. I'm disabled myself, being both registered blind and also living with a long-term health condition. And I'm also fortunate enough to be self-employed and have a little part-time work. And I want to come into that a little bit more when we get into the discussion, because I think there are some important points about how we tend to tarnish everybody with the same brush in terms of the depiction of disabled people by Social Security. But it's really good to be here and happy to take your questions.
So I just going to ask you, part of our conversation is just your reaction to those findings, Hussein.
So it won't surprise you, Pauline, that I see myself very much in the report. I think it depicts really well the structural scene that we have. Two strands of that, really, the emotional and experiences that people have of Social Security. But I think also it's very interesting to see depicted in the report the public perception of Social Security and how that is being influenced by the way in which the system is described by our leaders, our politicians, and how that then feeds back almost as a self-fulfilling loop onto disabled people, how they see themselves. And we've had some examples of that today. So I very much commend the report. The actual process itself was extremely well done. It was cathartic in some ways to hear other people's experiences and know that we're not alone, but also just to pick up on your point about creating something that was accessible, even for someone like myself who's visually impaired, to have that support without any questions being asked was very much appreciated.
So what's your views on the experiences of disabled people accessing universal credit?
So I think if I can just very briefly touch on the devolve aspect of this, just before I go into the detail of UC. Some of you on the call will know that Social Security was devolved to Scotland. I would urge you to read the report from the Auditor General that was published very recently about the experiences of welfare in Scotland, and it overwhelmingly shows a positive experience, about 75%, if I recall. It commends the co-production of that system, and it also statistically reports fewer reconsiderations, fewer appeals, and fewer tribunals. So that is, it's not a fantastic system, because there are things that can be improved. But if we're starting from a point of comparing and contrasting, as Trude said, that would be certainly one to look at and contrast. Going into universal credit, I think I probably share the view of many disabled people that DWP seem to be gatekeeping entitlement, especially with the increasing criteria and thresholds that are applied. The language that is used is degrading. It actually makes people scared to engage with a system which on the face of the tin should be there to help us. It should be there to give us what we need to try and live the most fulfilling lives. It's not a compassionate system, and certainly the times I've had to deal with the department, I very much feel as if I'm in some sort of an exam. I'm always trying to second guess myself thinking, is what I'm saying going to be misinterpreted or construed as something else? And is that going to be used against me? It feels very much as if you have one hand tied behind your back. You're the guilty person. And that goes hand in hand with the narrative that disabled people should somehow feel grateful that the state wants to make us equal citizens and are giving us what we need, even though there are countless examples of where that is not the case. I think there are some structural problems with UC itself. It denies the existence of certain conditions. There's this portrayal that disability has come out of nowhere. And we've seen that particularly recently with ADHD and neurodiversity. It hasn't come out of nowhere. It's simply because people are more aware of their entitlement. Testing is better, and people know that support is available. And all of that makes the system even more stressful to deal with than is necessary, but also potentially putting off people who could use that support.
Thanks, Hussein. My next and final question to you is, what are your thoughts on what we need for good experiences of social security?
This is where you'll have to try and keep me to time, Pauline, otherwise we'll be here all afternoon. So I think first of all, I'll deal with the public perception, because that is a huge impact on disabled people. We don't just deal with our caseworker. We then have to deal with everybody that we meet on a daily basis and what they think of us. And at the moment, we have a system that says we're spending X amount on Social Security. It's disabled people's fault. They're not pulling their weight. They're indolent, they're lazy, they're not willing to work. And they're the reason why other systems in the country, such as healthcare, are failing. And with that pervasive narrative, it's no wonder that disabled people feel lonely, isolated. They don't want to have a target printed on their back. So we need to reframe that narrative into what disabled people can do, what Social Security is there for. It's primarily designed, yes, as some sort of a minimum income guarantee, although that needs to be radically ripped up and redesigned from the ground up. But it's also designed for disabled people to meet the additional costs. It's not there as a supplement wage. It's there because we have needs that are beyond our control, and we want to play equal parts, and we have those additional costs which non-disabled people don't have. So a significant reframing of that. We need to try and join up Social Security with the rest of the system. It's not the be-all and end-all of trying to have a good life and a fair life. It needs to be integrated into health. It needs to be integrated into employment. On the point about employment, it's always been a bugbear of mine that disabled people are seen as not working. I'm self-employed, thank you very much. I'm proud to be. And I just want to be given the tools to get on with what I want to do, and not get wrapped up in constant reappraisals and having to justify what I'm spending and why I'm spending on the support that I need. We have a problem with data across the country, particularly when it comes to means testing, in that because we do things at the end of the financial year, it's leading to disabled people building up huge amounts of overpayments of benefits where they are able to work and they're maybe not entitled to that, and then having to claim back. So it's then a double-edged sword. They have to pay this money back, but at the same time, their costs are not reducing. So there are systemic problems we need to look at as well. We need to value unpaid work and volunteering. Work is not the be-all and end-all. It shouldn't just be about you should go and earn an income so you don't be a drain on the state. A lot of people volunteer, quite rightly. They provide a huge economic benefit to society and a huge benefit to their own physical and mental health. We need to create more opportunities for disabled people who can work to get into work and have the support needed. So the new UC reforms around access to work just do not make sense. It's almost as if the state wants more people not to be able to work, just so it can use us as the national punching bag. And finally, because I could go on forever, but finally, we need a much better process of review and reflection and iterative improvement. I have been on some sort of state benefit since I was a child, so over 30 years ago. I don't think I've ever been asked about my experiences. I don't think I've ever been asked about what could make the system better. I'm not asking for changes to be made overnight, but how can you constantly try and reform a system without actually checking with the people who use that system, it begs the question, who are you reforming it for? And I don't think disabled people, people who use the social security system, are blind, pun intended, to what is happening. It doesn't seem to be a very good way of building trust and relationship with the state. And we do need to be mutually cooperative in that.
Thanks so much, Hussein, and thank you very much for your participation in this research. I'll pass back to Laura. Thanks for the time.
Thanks, Pauline and Hussein. It was really great to hear your reflections there, Hussein, on what needs to change to make the system better in the UK, and also to touch on what's going on in Scotland as well as part of this project. So before I pass on to Tracey, just to say, please do add anything to the Q&A if you have any questions. We'll have a little bit of time at the end, hopefully, to get to those. So yeah, over to you, Tracey Herrington from APLE Collective.
Thanks, Laura. I'm going to try to share my screen. Let me see. Okay, right. Oh. You have to excuse me. I don't pass any tests on sharing correct. Here is how do I shut it down so it's like a slideshow instead.
If you click slideshow at the top,
I'd love to if I could see it.
it's the tab in the middle. So
It's
next to animations, to the right of that tab, there's a slideshow tab.
Right, hang on, I'll minimize it and see if it'll come up there. Oh, good Lord.
Tracey, I can share my screen. If you stop sharing, I'll share my screen, and and just tell me when to flick through if you want.
That is lovely. That's the I've lost you all now. Right, hang on. Stop sharing. I do apologize because this is taking up my time. I've stopped sharing. Come on. Anyhow, while Pauline's trying to help me out, I do apologise for all that. Thank you, Pauline, Hussein and Trude. I will be repeating some of the comments that have been made already. So a lot of the findings that we found in the UK reflect the points that have already been raised. So my name's Tracey Herrington. Today I'm representing the APLE Collective, which stands for Addressing Poverty with Lived Experience. We're a network of a number of individuals and organisations throughout the UK who are led by people who have lived experience of poverty and socioeconomic disadvantage. So we're very situated in our grassroots communities. We have a broad demographic of people. So we have organisations from Stoke, from London, from Manchester, even up in Scotland. We have the Poverty Truth community up in Scotland that are part of the collective. And our aim, like a lot of people who work in this field, is to ensure that people who have direct experience of poverty are able to have that opportunity to affect the decisions that impact on them, so that meaningful change can happen. And I think that reflects on the point that Hussein brought up earlier on. If you're going to create changes, you know, with all the best intentions, if you don't have direct experience or that insight is not there around the table for discussion, then it's very difficult to meet their actual needs. All right, so you can move on to my next slide, please. Thank you. So again, our methodology, we had 3 workshops across the country. We used a base in London, which was with ATD Fourth World, and they're based in Southwark in London, and they primarily work with you know, families and people who are welfare benefit dependent, who have some type of benefit or entitlement, and they do a lot of work around the right to family life. We also worked with expert citizens, again, grassroots organisation, work on a national level as well, but work with people, you know, who may have suffered homelessness in the past, may have some type of dependency, may have some caring needs, responsibilities, or some health issues. And then there is Thrive Teesside that I manage, which is a small grassroots charity based in Teesside. We work in Hartlepool and Stockton-on-Tees, and our beneficiaries, for want of a better word, or people who we work with, are generally have welfare issues, caring responsibilities, single parents, or low-paid work. So we worked with 21 people. We had 21 conversations, 3 rooms, 3 conversations. We worked, you know, we adopted a participatory approach to this. Used a lot of art, design work, which is, again, I think that's what Pauline talked about, you know, where you cut up magazines and, you know, use keywords. But there were communities that we knew. And what's really important when you're trying to get a full debate with people, it's that you have a relationship with them, so they are more inclined to share their insight, their knowledge and their experiences. So we used a variety of creative approaches. We built the conversations. We looked at, you know, application process. We looked at staying on your claimant, you know, and it was generally universal credit or personal independent payments. So next slide, please. Thank you. So our findings, again, echoed what's been said. In particular, there was a lot of feedback around the knowledge gaps with assessors, if you were going for a claim around personal independent payments, if you will want to know how many hours you needed to work, you know, how many, not hours that you needed to work, but if you were already on a claim, having universal credit, and you say you were working 16 hours, how much did you have to top it up? There was knowledge gaps around, you know, the relationship between volunteering and not volunteering. There was knowledge gaps around, you know, how far do we have to travel? Is it 90 minutes? So there was a lot of knowledge gaps, and there was also knowledge gaps with the claimants themselves. It was very, very difficult to navigate the system. It was burdensome, and you know, a lot of things that had to be done were online, which created a lot of problems. Stigma and labelling. People felt unworthy. They didn't feel that this was an entitlement. They felt that it was something that they had to really fight hard to get. And if they got it, they felt that they were undeserving. The undeserving and the stigma and the labelling led to a lot of fear and anxiety. And in particular, the fears were around, if I'm late for my appointment, will I be sanctioned? If I don't say the right thing to my work coach advisor, will I be sanctioned? If I don't, you know, give them the right information, will that impact on my claim? That then created anxiety. There was a big issue. There was a couple of people that we worked with and had conversations with who had children who were of adult age, and because of the bad experiences going to see their work coach advisor, they then withdrew from universal credit. The anxiety of going and having an appointment with their work coach advisor was too much, so it led them to not claim anything, which then put an extra burden on the parent, who then had to financially support our young adult children. We had the same comments, which is, you know, that came up in the last presentation, that it was quite intrusive, and that people felt that they were being watched, spied upon, and a lot of expectations put on them. We had comments around people checking their PayPal if they'd spent some money on something, and then had to justify what they'd spent the money on. This then created lots of mental health problems, which again linked back to the fear and anxiety. And then people talked about the system not being fit for purpose. We did have some positive feedback, and some parts of the journey, particularly when people were maintaining the universal credit claim, if they had a work coach advisor that they had probably seen over a number of months and they'd built up a relationship with them, then that seemed to lend itself to better outcomes, and people didn't have so much fear about going to the job centre that day. But this was in the minority. The majority of comments and feedback, no matter what part of the journey, whether it was applying or whether it was maintaining a claim, the majority of the feedback and the contributions and the comments made were very negative and very challenging for the people themselves, which then created further fear and further anxiety when they had another appointment with the work coach. I think the system not being fit for purpose, as well as predominantly most of the application process or managing their claim needed to be done online. And now sometimes people either A, didn't have a device, a smartphone or connection to the internet, or B, were quite scared of using the internet and sharing information online. So that became a fear as well. I mean, there was lots more things that had come out, but I think most of the key points have been raised in the two earlier presentations. So, but they were the key headlines for our findings. So can you just move on to the next slide for me, please? But we did have some solutions. And again, it comes back to the point that Hussein and Pauline had talked about. It's about having lived experience-led policy design here. If you don't have experience of a particular area, and in this case, you know, accessing benefits, maintaining a claim and commitment, things like that, then it's very difficult to fully understand the implication of the policy design. And so without that, sometimes it's unintended. I would guess it would be unintended consequences. Sometimes, you know, maybe they're not designed to create further harm or hardship, but they just don't fully acknowledge that insight that can lead to a better policy design. So lived experience central to this, and what we mean by this is lived experience of the claimant process. So it's about changing the approach, and it's about working, you know, the Tim's reviews now at the moment talking about how do we, you know, co-produce this or whatever. This is probably an opportunity to do something, but beyond our findings from our claimant conversations. So when you're changing the approach, then there are some other things that can be done in the short term. So it was about payment certainty. They wanted to stop the advance payments. That 5-week wait to get your universal credit in particular was creating a lot of debt and a lot of financial insecurity for people who were already struggling. And they also wanted, you know, the recommendation was to stop sanctions. That's in nobody's interest. If people are already struggling and don't have enough income to get by, then withdrawing a payment, an entitlement is going to create further hardship. So that was a concrete step to do in the short term while we change the approach. I think there was something to be learned from, you know, there were some examples of if you had a good work coach advisor and met your needs and your claim and commitment was developed with your work coach advisor, that could lend itself to, you know, moving people on and forward, if that was the right thing for them to do. So they thought that they needed to offer support. Staff should be offered training in in-person support. Job centres should be relaunched as a safe and welcoming space. It was getting rid of or removing, you know, that visibility of, you know, the security as you walk in, because that sort of, it didn't make people feel safer. It antagonised the situation. It was about offer online benefit application options for those who were digitally excluded. That was another positive thing. And I think it was about looking at them needs. Work available needs to be possible. So looking at, do we need to travel 90 minutes to get to a job? Can it be flexible around caring roles and accessible on transport routes? Could there be free bus passes to offer to benefit recipients? And in some cases that does happen. So people can travel to a job. And can we just, you know, some of the lessons to be learned now, trial things to see, so that the work meet the need of the person and the economy around us. I think what we need to be mindful of is there are not a lot of jobs out there in our area, particularly in Teesside, that would enable people to realise the potential and be financially secure. So people can be struggle a lot more financially because of the hours that are made available and the rate of pay. And I think that was me for some of that. And I do apologise for not being switched on with me presentation.
Thanks so much, Tracey. So I'm going to quickly move on. We also have Mark Simpson, who's from the School of Law at Ulster University, who is an advisor on the Welfare Experiences project and is also a co-lead of the Nuffield Foundation Safety Nets project on devolved social security in the UK. So Mark is just going to share some reflections on the research that we shared today. Thanks, Mark.
Okay, thank you, Laura. Great to hear from the other speakers, and it's really nice of the team to invite me to offer some reflections today. The Welfare Experiences project has got so much potential. It's shaping up to be a really great piece of work. Relatively early days, but I think we can expect a lot from it. It's a pleasure to be involved, even in a fairly minor way. So I'm going to offer a few reflections, drawing in part at least on some of the bits and pieces of research I've done on social security, particularly in the devolved context, and also on destitution and paths to justice. And I'm organised those a little bit around the three key terms for the project of dignity, security, and fairness. Like taking them in reverse order, can probably deal with fairness fairly briefly because there isn't much explicit reference to it in the report, although it's clear enough from the quotes that are carried that there are examples of practices that the participants definitely perceive as unfair. But those things, they kind of feed it into to a large extent the two remaining points anyway. So I'll spend a little bit more time talking about security. One really striking finding from the Destitution Paths to Justice survey, or a study that I was involved with along with my colleagues Grania McKeever and Ciara Fitzpatrick, was the way in which people describe themselves as being capable of surviving on surprisingly low incomes if they had security and consistency in that income. Any major fluctuations in their entitlement, any sudden loss of their entitlements would then very quickly create chaos in what was already a precarious way of life. So that security of an award can matter almost as much as how much money is awarded in a lot of cases. And so much of this report is really about things that contribute to insecurity, things that either make it hard to access a benefit in the first place, or things that make it harder to keep a claim going once an award has been made. And quite often we see that uncertainty and that lack of security being described as going hand in hand with complexity, whether it's complexity of rules or complexity of processes. It taps into, I guess, a bit of a prevailing narrative in academia and other ways that that complexity in social security is necessarily a bad thing. It certainly brings its problems. I think it's probably worth noting the work that Neville Harris has done in this area at the University of Manchester, which sort of gently pushes back a little bit against this. Neville argues that people's lives are complex, so any system that provides effective support must also be complex. But as we see here, and as we saw in our work on destitution, a complex system creates problems where people don't have the legal capacity to understand what they might be entitled to and what they need to do to access those entitlements. And it brings a need for support, whether that support comes from inside or outside the system. And if that's missing, it creates big problems for people. And we know that that support from outside the system in particular is really hard to access in, in large parts of England and Wales in particular, because of the funding cuts there have been since 2013. Some of Ben's other research with Dan Edmiston and others illustrates that very well. It illustrates as well that support from state sources can be pretty patchy as well. And the recent report by the Scottish Commission on Social Security, of which I'm also a part, on how people with communication needs access social security in Scotland, showed that even within the same team, within the same social security agency, there can be quite a lot of variation in the quality of guidance that people get on how to navigate the system, and we see that in the findings in the report too, very clearly illustrated. So this study could be the closest look at complexity in social security that we're going to have since Neville Harris's work. So it's going to be really interesting to see what contribution it makes to the debate on how we can, either reduce complexity or help people live with the complexity that exists. Moving on to dignity, the third of the kind of headlines for the study. Couple of ways of looking at dignity. We can look at this from an individual perspective about whether each person who's using the social security system feels that their dignity has been respected or not. And this report is just littered with examples of where people either explicitly or implicitly reported that this hadn't been the case. There's the physical effects of having to visit an inaccessible office, the level of surveillance the Social Security Authority is able to put people under. A really striking example of a participant who felt that they had to appear humble when they were speaking to their caseworker. None of that is going to create a sense of dignity when using this service. And it's from other research that we've seen from Ruth Patrick from the welfare conditionality team and plenty of other sources, it's probably unsurprising that some participants would describe their treatment in those terms. As a legal academic, I'm probably bound to say we should maybe try to take things from the individual perceptions of dignity to look at a sort of more consistent and legally grounded view of what that might mean, because if we've got a system that's prepared to listen to what people want, to feel that their dignity is respected, then those individual perspectives will hopefully be taken on board and result in action. But if we have a system that's maybe a little less interested in listening, then a legal perspective can maybe offer a more effective way of challenging some of the practices that go on. Chris McCrudden, who's a leading authority in this, places a great deal of emphasis on dignity as protection from inhuman and degrading treatment. And it's not too great a leap to say that that's what some of the participants were reporting, at least in their terms. I think in future phases of this work, it'll be really interesting to have a closer look at the detail of some of the individual experiences and encounters with the system, to see whether incidents that participants describe as undignified or dehumanizing or degrading look the same way from a legal point of view, and whether there is scope to challenge some of the things that are causing them problems. So that's just a few reflections on what I've seen. I'm sure some of you here may agree and many of you may disagree, but I think we can all agree that it's a really good project, and I'm very keen to see what comes from the further engagement across the 5 countries.
Thank you, Mark, for joining us today. And we're running out of time for having some Q&A. So there's a couple of really good questions around the Stephen Timms review of PIP and from Kerry Hughes and Kate Summers. And we could get back to these as a team and maybe publish an answer or a blog around those. So thank you for those. In the last few minutes, Ben, so good luck. Over to you just to talk about kind of next steps for the Welfare Experiences project.
Yes, I'm going to be very quick, but I just wanted to sort of close. I mean, thank you to everybody for taking part. That's been so interesting and so much work behind so much of that. I just wanted to say to people outside of the Welfare Experiences team, you know, this is the start of the Welfare Experiences project. So where are we going from here? So the first sort of the most immediate thing is that the conversations with people receiving benefits in their 5 countries it's sort of been combined with a kind of review of academic work and then a lot of discussions online and in meetings and in face-to-face meetings. We're trying to say, well, how can we think about the experience of receiving benefits in a way that works for all these different people in these different countries? So this is just, we've got various versions of it, but this is at core like the simplest and clearest version of it. So I just want to point out kind of 4 things about this, but really interested in people's feedback on this, and we'll write this up shortly. The first thing is that, you know, the easiest way we found of communicating the different things that matter is to say the sort of 7 headline dimensions. So in looking at the positive side, you know, a good experience of receiving benefits would be one where there's security, it's just, as in justice, it's straightforward, it preserves dignity, it's compassionate, it's empowering, and it's supportive. There's a lot of things underneath that, but as a way of summarizing all the different things that people said were important is one of them. A second set of things is these things matter because they influence a whole bunch of other things, people's behaviors in terms of benefits or work, health and well-being, relationships, and people's trust in the state as a whole. And in terms of trying to change those experiences, that obviously depends on a whole bunch of different things in the benefit system, from the very smallest level to the most widest level of how people talk about benefits. And the final thing about this conceptual framework to highlight is just that different people will experience things in different ways. So for example, you know, some people might experience an injustice and react in a way of getting very angry about it. Other people might just disengage completely, and that will lead to a whole different set of different outcomes. So different people, based on a whole bunch of different things, will react in different ways. So that is our sort of current thinking about all of this. And the idea behind all of that is to help us underpin everything else we're going to do. So we want to try and deepen our understanding of all of the different parts of that with both qualitative and quantitative research. So with the qualitative research, this is trying to understand things in as much depth as possible in each country, and also to understand how things unfold. And rather than just doing one-off interviews, we're going to try and work with people over 6 months, where people speak to us through an app about all of their experiences over that time. And then we chat in response to things that come up at the moment that things come up. And, you know, continuing the ethos of the start of the project, trying to continue to co-produce the way that this is designed and the way that we analyze it. And alongside that, we're going to have some quantitative research to try and say, well, which of these things are more or less common in which countries? So that'll be coming up in the next year or two, combined with a way of us trying to look at how things play out causally. So we'll follow people over time and try and look at natural experiments, like people in the UK moving from ESA to universal credit. So just really to finish on that, because I know the time is up. You know, there's a shared goal within the project, but also from many of you that have come to listen to us. So, you know, the final work package in the project is about impact, and we'll be talking about policy toolkits and videos and animations in due course. But also we would love to work together. I mean, many people involved in the project are already working with many of the people outside of the project. But we'd like to kind of continue that. So this is a sort of an open invitation, not just to sign up for our email list and follow us on Blue Sky, but send us the things that you're doing, your ideas, your criticisms of things that we've been doing. And also if you've got anything that you would like to do jointly with us, whether events or deeper sorts of collaborative working, we're really keen for this to be the start of a conversation with lots of people. So I'm just going to stop there.